Exactly 1 year ago, we all began this life-changing journey. The Bay Area was ordered to shelter in place. We had no idea what that even meant and what was coming our way. Soon after, we reached out for help to some local doctors. Those local doctors turned out to be among the country's leading voices in this fight against COVID. Tonight, we meet them face to face. First of all, it's nice to see you in person. And we appreciate, personally and professionally, appreciate all that you've done for the community.
It's kind of an emotional experience to see you and other members here today.
Dr. Peter Chin Hong was one of our first medical contributors. The infectious disease specialist at UCSF is on the front lines treating COVID patients. We met him at UCSF on this one-year anniversary. We've also leaned on Dr. Bob WACHTER, who chairs the Department of Medicine at the university. Both doctors are now internationally recognized. Not just their medical analysis, but for us, they share the human toll of treating patients.
I remember the very first patient I took care of, and the reason why it's stuck in my memory is because he was very similar age to myself, and just not realizing if he would have access to drugs. He was like really ill. He was already about to get a breathing tube. All I can do is just hold his hand, and I think a lot of times in medicine we give a story of what to anticipate, but in terms of COVID, we didn't know what to anticipate.
How have you changed as a doctor?
It just helped me understand and face my own mortality. I think I've been doing that more and more over the year. Every moment I have, I just think about it as that moment and not taking it for granted.
In early March, I found myself, UCSF went to basically a healthcare version of martial law. I run the biggest department in the institution. I usually have a lot of decisions to make, and I found myself having nothing to do because, quite appropriately, about 4 or 5 people were given the authority to run the entire enterprise. It was all COVID. And I sat there at home taking in this fire hose of information. And part of why I started tweeting and doing other things to try to communicate was to give myself something to do and to feel useful, because otherwise I was sitting there as a 63-year-old guy with asthma and feeling like, I could die from this.
When did you know it was as serious as it is?
It could happen to all of us, because if it could happen to Italy, it certainly could happen to the U.S.
Once Italy became clear how bad it was in Italy, I think it became clear. And then I remember listening to The Daily one morning, the New York Times podcast, and listening to Donald McNeil, their science correspondent. And he was talking about the Great Influenza in 1918. And he said everybody knew someone who died. And I don't know why that resonated with me so much, but that was a light bulb moment.
Was there a low point, and can you describe it for you just as a medical professional in this last year? When was it and what were you going through?
I hate to get too political, but the low points mostly had to do with Trump. I mean, they really did. It's hard to pinpoint one particular moment, whether it was the bleach or the it's going to go away like magic, or when he got sick, that was a particular low point when he came out and said, look, I'm fine and don't worry about this, it's okay. That was the throw your shoe at the television set moment for me, where I was just so pissed off. And I think as I look at California, I look at San Francisco in particular, we've had a fair number of deaths, but we've done so much better than the rest of the country. And by my calculation, if the country had mirrored San Francisco's death rate, there would be about 300,000 people alive today that died. So I think there's a lot of unnecessary death.
Were you surprised about how political the medical world can be and the healthcare world can be?
I was surprised by the degree to which decisions about the pandemic were politicized. And if you told me in January 2020 that whether you wear a mask or not will be a sign of which team you're on, I would have said, how could that happen? That's impossible. And yet it clearly happens. Over the last couple of months, I think we've seen what better leadership would look like. And part of what it looks like is it almost fades a little bit in the background. It's not the issue anymore.
When are we going to realize how much this costs us in terms of mental health?
I still think we're in the infancy in understanding the the real impact that this pandemic is going to have on mental health. And we're not just talking about mental health going to the inpatient psychiatric unit. We're talking about mental health in very subtle ways, like loss in productivity, loss in thinking I don't have the strength or the resolve or the determination or the drive to go and get this job.
I think there will be a price to be paid that will play itself out over time. And one of them is the mental health sort of meets the schools thing. I mean, for kids that really lost a year and a half of their life in school, you know, I think that's one where the advantage of certain people and disadvantages of others will become clearer. That's going to be a hard thing to make up.
We think about these kids who've missed school as going to be the lost generation at some point.
What's your idea of the year to come now, going into 2022?
I think by the summer, we're going to be in a really good place where people are able to do almost everything they want to do outside. I'm hoping everybody chooses to take the vaccine. It's miraculously effective and extremely safe.
And I hope that in the future, we all get really behind the whole idea of prevention. I know prevention is not sexy. It's not like a new fangled new drug. But it's a hell lot cheaper to have a pandemic office than to try and, you know, fly the plane and learn to fly the plane while the plane is flying.